A lot of us don't remember our first sunburn. We don't remember how much sun exposure we've had throughout our life. However, our skin remembers.
Because I think a lot of people assume once a sunburn fades, the damage is gone, but that's not really the case.
We can't undo what we've done in the past. However, we can always make changes now that can impact us in the future.
Hey everyone, welcome back to Pulse Check. My name is Tracy Robinson. I am the administrative coordinator and a practice manager with Carolina Pines Medical Group. And joining me today is Dr. Jared Stahlecker, one of our newer Carolina Pines primary care providers. Dr. Stahlecker, welcome. It is great to have you.
Yeah, thanks for having me.
Thank you. Why don't you start off by telling us a little bit about your journey here, as your role is very unique here at Carolina Pines.
Yeah, of course. Well, first off, I'm happy to be here down at Carolina Pines. So I'm a family medicine physician. So I take care of patients from pediatrics all the way to geriatrics. I came down here specifically to start a family medicine residency program since I've been in graduate medical education for the last 10 years. And so we have a unique opportunity down here to start a good training program. And so we came down here to do primary care and start hopefully a high quality education program to train doctors that will stay in the area and take care of people here in Hartsville.
That was awesome. I'm personally so excited about that.
Yeah.
The growth that's going to mean for the community, for the family physicians that we end up having for the community members, very exciting.
Yeah, I think it'll be a unique opportunity to one, elevate the care that we provide here at Carolina Pines, because we'll be more associated with MUSC, so we'll have integration of academic medicine. We're going to have young blood around that's going to help push everyone to try and do different things that are good for patient care.
Oh, absolutely. Absolutely. Well, thank you again for being here. Today we are talking about something that's especially relevant this time of year, skin health. It is hot, 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 but we still seem to find ourselves outside more, whether we're doing lawn work, gardening work, enjoying the beach, maybe the pool. So to start us off, what do you think so many of us underestimate the impact that sun exposure can have on our skin?
Yeah. Kind of also the duration of how much sun exposure we have throughout our life. A lot of us don't remember our first sunburn. We don't remember how much sun exposure we've had throughout our life. However, our skin remembers. And this is something that adds up over time. And so generally, in a lot of my practice of seeing patients with early skin cancers or things like that, we start to see this in our late 40s, 50s, and 60s. However, that damage didn't happen overnight. And so this is something that we want to make sure that even when we start young, that we're having good skin protection.
Absolutely. That is a very important point, because I think a lot of people assume once a sunburn fades, the damage is gone. But that's not really the case. So can you explain what's actually happening beneath the surface of our skin when we are exposed to UV rays?
Yeah. So the sun has a different spectrum of light that we can see and things that we can't see. And so the main ones we get concerned about are, we call them UVA and UVB light. And what that does is, depending on which one we're talking about, they penetrate the top layer of the skin, or they can penetrate a little bit deeper. And that's where our skin cells live, and that's where new ones are made, new ones are grown. And the issue with these UV spectrum of light is that they can change the DNA of those cells a little bit. And our body does a really good job of correcting these changes. However, they're not perfect. And that's where over time, we can notice that abnormal DNA can get in there, which can lead to increased risk of cancer.
Okay. Very interesting. Did not know there were different types of UV rays. I also think that ties into something many of us have heard for years, that a little color or a base tan is somehow a good thing. Is there really such a thing as a healthy tan? What does a tan actually mean for our skin?
Sure. As someone who's naturally pale myself, I mean...
Not alone.
Exactly. No, any type of tan is generally concerning for your body actually responding to danger. Is because our body gets darker from the sun to protect itself from those UV rays. And so every time you're seeing anyone with a tan, it's generally their skin has been exposed and it's trying to protect itself by making more of that pigmented skin to stop itself from getting burned. So generally any tan is not considered healthy. Now, culturally, it's been very important for people to get tans because you feel like you look healthy, you look like you've been on vacation, and then you want to get a base tan before you go down to Mexico or before you go to the beach. However, all these things is exposing your skin to increased risk of damage from the sun. Now, there are alternatives to getting your tan from the sun, and that's like the spray tans or bronzers, but there's always that risk of looking orange and kind of ridiculous. But they've came a long ways over the years.
Yeah, absolutely. Nobody wants to look like an Oompa Loompa. So for those that are listening who may be thinking, I spent years in the sun, used tanning beds, had my share of burns, the damage is already done, so what's the point now? What would you say to them?
Same thing I would tell a smoker. If you quit today, we're stopping the damage that could be occurring for the future. We can't undo what we've done in the past. However, we can always make changes now that can impact us in the future.
Oh, very true. Very true. I love that perspective. It's a great reminder that skin health isn't about being perfect. It's about the choices that you're making moving forward.
Oh, yeah. I was thinking about this morning when I was walking the dog, and we're new to South Carolina, right? So I'm from the Midwest, from Minnesota, Wisconsin, where, we have a good time of the year where in the winter where we can maybe get 8 hours of light.
Yeah.
You go to work and it's dark, you go home and it's dark. But coming down here, I'm walking my dog at 7:30 in the morning and the sun is already beating on me. And so having that plan each day of how do I protect my skin, even for a 30 to 45 minute walk. But if I add that up every week, every month, every year, that can really play a toll on my skin.
Yeah, absolutely. That's a great perspective. So let's talk about what protecting our skin actually looks like. What are some of the biggest misconceptions or mistakes that people make when it comes to sunscreen and safety?
Yeah. So the biggest one you'll see is thinking sunscreen is an armor. Is that minute you get up, you put your sunscreen on, you're covered for the day.
Yeah.
Right. So I got my armor from the sun. I'm ready to go. And the mistake that happens is sunscreen doesn't last all day long. So generally, it'll give you about 2 hours of protection, depending on what you're doing. So if you're just outside enjoying the sun, 2 hours, then you would want to reapply. But if you're at the beach, you're running around, getting sweaty, getting water on it, you may want to apply more frequently. And another common thing is we also don't put enough on. We'll do a little squirt, put it on our face, put it on our hands, a little on our arms, and then we call it a day. And realistically, that makes us feel good, but it's not really doing good for sun protection.
Yeah, just a little spray.
No good.
All these sprays, you walk through them and then you choke it down. So let's break it down just a little bit further because this is where I think a lot of people, including myself, tend to get confused. What SPF should we actually be using? Are there certain ingredients that we should be looking for or avoiding in our sunscreen? And does a higher SPF always mean better protection?
Yeah. So generally for most patients or most people, SPF 30 is a good baseline to start at. Now, someone who's very fair-skinned like myself, generally 50 is a good option as well. But 30 to 50 is that sweet spot where you're going to get the most protection. Now, they do have different versions of sunscreen, some being kind of that mineral zinc oxide protecting, and then ones that seem like they're more chemical. There's no really significant difference between the two in how they do for skin protection. The one I usually recommend is the one that you use. And some people feel more comfortable using the mineral ones with zinc oxide, and some feel it doesn't matter to them. It just matters on which one that you wear.
So let's talk about the practical side of things. How much sunscreen should we actually be applying, and how often should we be reapplying it?
So about a shot glass of sunscreen, so about 1.75 ounces for your whole body. So if you're going to have your shirt off, wearing your shorts, or wearing a bathing suit, probably about a shot glass is good. So for the face, generally, you want to think about 2 finger breaths. So if you covered from about mid finger all the way on for 2 fingers and covered your face, ears, and upper neck should be sufficient for that coverage. And again, it's going to be 2 hours, every 2 hours when you're out to apply. And it's going to vary depending on what you're doing. So when in doubt, you can always put a little bit more on.
Never hurts to put a little bit more on. A little too much, better than not enough.
And I don't have a brand preference. In our household, it's whatever's on clearance at Walmart is what we get. Because in the end, if you compared all of them and you did different studies on them, you'll find out that they're more or less all the same. It's just the consistency is the most important aspect.
Well, and that's good to know, because I think a misconception with a lot of things, including sunscreen, is if it costs more, then it's better.
Or if it's a brand name, or it has that, that little girl getting her, but the dog biting her swimsuit. Yeah. In the end, I don't think it really necessarily matters. So that's why we always are clearance brand shoppers, and we just pick it up, use it, and then move on with it. Now, sunscreen, what is interesting that I learned a couple of years ago is you do not want to let it sit or expire for too long, because it is one. We've always been ones will eat expired food or use things, but sunscreen actually is one that will degrade over time. So you want to try to use it prior to the expiration date. Okay,
that is good to know. I know for a fact that I have some expired in the cabinet that I have already used this summer. So beyond sunscreen, what are some other simple habits that could really make a difference in protecting our skin?
Yeah. So one of the most important things is avoiding the sun during peak UV time. And that's usually 10 a.m. to about 4 p.m. But that's generally like the most fun times to be out.
Absolutely.
However, taking frequent breaks. So if you're out, you go to Myrtle Beach, you get out at 10, stay out till noon, take a break, go have lunch, get out of the sun, reapply sunscreen, and then head back maybe around 2 to 4 in the afternoon for more beach time. The next step would generally be protection. So wide brim hats are really important to cover the face, the ears, and the neck. I got me a nice Indiana Jones style hat that now I've started to wear when I walk the dog. I know I feel ridiculous, but it's better than having to get anything cut off of my ears or nose when I'm older.
Absolutely.
Next step is sunglasses. We want a nice sunglasses that protect against UV. And generally you want to wear those when you're outdoors. And then they make a whole variety of, I think it's called UPV or UV protection clothing.
Yes.
We have a whole bunch of these for our kids. We make sure that they're wearing these when they're out in the pool or at the beach. But now I've had to start wearing those when I'm mowing the yard, we're planting trees in the back of our property, or anytime we're out in the sun for more than about 15 to 20 minutes. So that's that added layer, because all these things add up to good protection over time.
Oh, absolutely. So now we've talked about prevention, but it's also important to know what our skin may actually be trying to tell us. One thing that makes skin cancer somewhat unique is that it's often something that we can't actually see. So what are some warning signs people should be paying attention to?
Yeah, because solar changes to the skin over time can be quite subtle. We'll start to notice as we get older, we get more blotchy, brownish spots on our arms and on our face, and we'll say, geez, I'm getting older. The other part is, what does our skin look like, and what are the things that could be concerning? So generally we'll use the A, B, C, D, E terminology for when we're looking at lesions. So A means symmetry or asymmetry. So generally most lesions or any normal moles or they should look the same on both sides, up and down. Be like, okay, it kind of looks the same. Okay. When we start to get concerned is when we see asymmetry. So does one side start looking funnier than the other side? Is one side growing, the other side shrinking? Those are things that are concerning. The B is the borders. So what do the edges of these spots that we have look like? Are they nice and smooth? Are they crisp? Or they're kind of growing out in one direction, or are they kind of weird looking? We want to get those looked at. Color is very important. That's the C. Are they uniform in color? Are there spots where they're dark blue or reddish or whitish? When colors start to change is when we start to get concerned. D is for diameter, generally about the width of an eraser of a pencil. Anything bigger than that, generally we want to make sure we get that looked at. Or if it's growing rapidly, that's that E for evolution. Is it changing? Doesn't look the same? Does it we call it the ugly duckling. Does it look strange compared to the rest of your normal moles or skin spots? Those are all things that should want to get those looked at.
That's great information. And there are other changes, maybe beyond moles, that should prompt someone to get those checked out. How often should someone be checking their skin or scheduling a skin exam with their provider?
Yeah. So generally, I want to see patients that have any new lesion or growth that's rapid or came out of nowhere. And so, I'll give you an example. I had procedure clinic this morning. So mainly I'll see patients that get referred that have some sort of skin issue that's new or changing or something they're concerned about. And we'll do the eyeball. We'll give them a good once over, look at them. And then if we see something that they're concerned about or that I find just on my clinical exam, then we do something called dermoscopy. And that's where we have a special light with a magnifying glass, and we really get in there and we can see what the lesion looks up close. And actually, with some of the way that the light looks, we can see beneath the skin to what the network looks like below. And that's that second part where it's good to get any suspicious new lesion looked at to make sure that it's not something that we need to be concerned about. And if it is, then we can set you up to make sure we get it taken care of. There is no good consensus from we call it the USPSTF, and that's like the screening recommendation body that, let's say, do skin checks or colonoscopies or mammograms at these times. There isn't a good recommendation that says start at this age or don't start at that age. So generally kind of leave it up to the patient's history. How many sunburns have you had? If you've ever had blistering sunburns, generally you should just recommend, say, hey, doc, can you take a look at my skin during my annual checkup? Or if you have any like new or suspicious spots on your body. Generally, it's the husbands that come in. Because it'll be the wife will say, hey, I don't like this spot on your back. And so if you have a significant other, make sure you look at their back and say, hey, it's time to go get seen for that.
That's good to know. Good to know. And so that's something that you can have checked out with your primary care physician. You don't necessarily have to start out with a dermatologist.
No, and most primary care physicians are trained to do general skin. They know the ABCDEs. They know how to identify a suspicious lesion. And a lot of us, especially over at the primary office, we do our own skin biopsy. So we can make the diagnosis of, is this a skin cancer or not, generally on that visit. And part of the unique thing with the residency program is we are currently running a procedure clinic where we will look at suspicious lesions. We do it both clinically and dermoscopy, and we do the biopsies at that time. And if it is something that we do find, like I had a malignant melanoma that we diagnosed 2 weeks ago, we removed the entire thing in the office, but we did continued higher level with the dermatology group that's 45 minutes away. But it gets you seen by that dermatologist or somebody that can do skin things sooner than having to wait that 6 months or 12 months it takes, unfortunately, to get in with most dermatologists.
That is great to know. So before we wrap up, I want to go back to something that we touched on a little bit earlier, because I think it's something that a lot of people need to hear. There may be someone listening today who's thinking, I wish I had known this years ago. I spent decades in the sun. I didn't protect my skin the way that I should have. What would you want that person to remember?
If you have something that's concerning, get seen. It's skin cancers or suspicious lesions are always better to be taken care of when they're small. Because the longer we wait, the longer that we sit on it, the more dangerous things can become, or the more effort we have to put into managing them. And then the second thing, I know you asked for one, but the second was just the basic things. Set up your life where you can easily put sunscreen on, grab a hat, put your sunglasses on, and a long sleeve. Just make that into your daily routine. And then reapply, and reapply your sunscreen when you're outside.
I think those are all great. Very important message for sure. So thank you so much for joining me today and helping us better understand that while our skin may remember the past, we still have the power to protect it moving forward. To everyone listening, go get your skin checked. You can get that done at your primary care office. It's simple, it's quick, and it is so important. Thank you for tuning in to Pulse Check. If today's episode taught you something, be sure to share it with a friend or a family member, because taking care of your health starts with understanding it. We'll see you next time.
Thanks for listening to Pulse Check. If you enjoyed this episode, be sure to like, follow, subscribe, and share it with someone who might find it helpful. Your support helps this podcast reach more people in our community. Pulse Check is a production of Carolina Pines Regional Medical Center. Special thanks to our producers Hannah Cadell and Anna Tingen. Audio, video, and editing services by Seth and Grayson Johnson at Lockwood Studios. All content is for educational purposes only. We do not intend for the content to be a substitute for professional medical advice, counseling, diagnosis, or treatment. Our content doesn't engage visitors into a professional relationship. We'll see you on the next episode of Pulse Check.